Good evening, I'm Kristen Baki. Thanks for joining us. Just a week into the school year, an entire Chisholm Elementary School will be learning from home for the next 2 weeks. That's after a letter from county health leaders pointed to an increasing number of COVID cases connecting to the Von Steffensrud School. School leaders were not able to share exactly how many cases. Starting tomorrow, the school's kindergarten through third graders will be learning from home for at least 14 days. County health leaders say Chisholm families should self-quarantine from activities and other group gatherings and watch out for symptoms. The Chisholm School Board chairperson told us tonight masks had been optional in the district. No word yet if they plan to reconsider that decision. That rise in cases at schools is coinciding with Northland hospitals running out of room for patients.
We really are encouraging the school districts to mask students and employees. And I know that's not a popular message, but we are scared. We're scared that a continued increase in COVID in the community will create a need for hospital beds that we just don't have right now.
That plea tonight from leaders at an Iron Range hospital, and they're not alone. According to the Minnesota Department of Health, the number of people in ICUs is the highest we've seen this year. CBS 3's Natalie Grant takes a look at the problems that's causing.
Hospitals across the Northland are strained due to a 1-2 punch of COVID-related problems.
It's different. It's different than what it's been before. And part of it's COVID and part of it's staffing.
Essentia Duluth is diverting patients often because of a lack of beds and limited staff. A concerning combination for critical care workers like Dr. Baston DeYoung, who knows the importance of timing in emergency situations.
I worry that there's patients out there that need very quick care that makes a huge difference. The timing makes a huge difference, and then they're just not able to do that.
And those problems aren't unique to Duluth.
The availability of beds in our own facility and the availability of beds at that next level of care facility like Duluth and the Metro really limits our ability to transfer patients out, and that gets really concerning.
Jean McDonald, CEO of Grand Itasca Hospital, says they have been diverting for 2 weeks. And with rising COVID cases in their community, they are worried.
Car accidents, heart attacks, just basic healthcare needs that come into our emergency room, and not having a spot for them in our facility, or if we aren't able to transfer them, having to hold those critical patients in our facility until we can find them a bed.
Hospital leaders from across the region wishing more people would understand the pressure they're feeling.
A lot of people are done with it, right? They're like, okay, we're done, but we're not done with this, or it's not done with us.
Those hospital leaders ask that people make regular visits to their primary health care provider to prevent visits to the ER. And when it comes to COVID, they urge everyone to wear a mask and get vaccinated.